Experts say a quiet killer is stealing the lives of teenagers. It's suicide.
Dealers are targeting kids and teenagers. And new at 6, we're hearing from a mother whose daughter died after taking this new drug.
You do things not just because it's a job, but because it's a mission or a calling. I started, I think, in the field, and for me, my clinical work, which attaches to this prevention education work, really started after my high school boyfriend took his life.
And thus began for Barbara Green an educational and professional journey to respond to a mental health crisis that few others had recognized.
Barbara's creative vision and her perseverance in making sure that Youth Health Connection is available to everyone in our region. She identified this need 21 years ago.
I have been given a gift of the ability to do this job because people have made it possible. The hospitals made it possible. They have been unyielding in their support, not just financial, but all of the other things that go with it.
This is something that we're not reimbursed for. No one pays us to do this. We rely truly on grants and the generosity of the people in our community.
People like Jack Spurt, whose thoughtful gifts allow South Shore Hospital to live up to its mission and serve the needs of its neighbors.
The definition of philanthropy is loving humankind, and I guess that's the way I would look at it, because I don't see myself as someone who's giving huge amounts to anything, but I try to dedicate my resources to the extent that I can to helping people. The Youth Health Connection is part of the home care program of South Shore Hospital, and the idea of that program is to really keep people from being hospitalized, to take care of them at home and keep them well. And starting with our youth is a great thing, I think.
One of the flagship programs of the Youth Health Connection is the How Not to Keep a Secret program, a suicide prevention program that incorporates a peer-to-peer education element. The program is embraced at schools like Hingham High.
Kids are oftentimes the first to know when one of their friends is having trouble. Youth Health Connection gave us a really great format to do this work. It allows kids to get involved in helping each other, which is very powerful. And it really teaches the students that they can have a role in helping each other, knowing maybe also when to get adults involved. And it really, on top of all that, it breaks down the stigma that surrounds mental health issues.
We have a really, really competitive public school program, and I think that all of that sort of can come together and clash in a way that doesn't really help.
A lot of it is just trying to fit in into like different friend groups, trying to get comfortable with yourself.
I think the greatest pressures on today's teenagers really is to be perfect, particularly in a school like this. There's a pressure to be the captain of a team, the star of the spring musical, and to be on the honor roll, and to take 5 AP courses.
The training, of course, taught us how to identify warning signs and try to pick out the differences between a bad day and a bad couple of weeks.
I felt like I had a responsibility after going through the program to make sure that I could watch out for any kid that might not be himself and might be dealing with the warning signs of depression.
You get to high school, which is like super big and scary. You immediately have someone or like a group of people being like, hey, you're not alone. We can help you if you want.
We've seen more students coming down to us as adults, whether it be guidance counselors or teachers, students coming and saying, I'm worried about my friend.
The Youth Health Connection is about recognizing the many needs of children and our needs as their parents, guardians, teachers, and neighbors.
The Safe Harbor Cohasset Coalition was founded about 9 months ago. We realized that with the increasing likelihood and overdoses and deaths and problems of this epidemic, we needed to hop in and jump in quickly. And I will tell you, the Youth Health Connection was really a lifeline for us.
What they do is they bring the connections. You know, they're the folks who can find experts, bring everyone in a room and start talking about real ways of making a difference.
The fact is, the need for the Youth Health Connection will continue to evolve and likely grow.
I think that there's something somewhere in the heart and soul of the hospital that gets it.
I have 5 grandchildren, and 3 of them live here on the South Shore. And every day I say a little prayer for my grandchildren that they make good decisions in their lives. And I think that's what we should think about for all of the youth on the South Shore.
I just can't think of any way that we could help the community more than to giving to the children of our community. And that's something that fundamentally I think we all believe in every day.